Good morning, everyone. My name is Jyoti Sharma, and I'm the CEO and founder of TaraCares. We are here at the School for Business and Society, and I'm delighted at the opportunity to give a talk on ethical entrepreneurship. What got me here? Why am I doing what I'm doing with TaraCares? TaraCares is a health tech startup, and we are trying to tackle the crisis of menopause health with computational science and artificial intelligence. So, to get started for today, this is what we have in store for you. We always begin with gratitude. We will talk a little bit about my journey so far, getting to where I am today. What's our vision? What are our orienting values? We are less than a year old. It was last year in May that we incorporated TaraCares, and we've taken some really fast strides in our journey. I'll talk to you about the scale and complexity of the problem that we are dealing with here. And why do we need another startup that's tackling and addressing the problem of menopause, which led us to redefining the problem and redefining what our solution is going to be. I'll give you a sneak peek into what we are building. We are made in New York and building it for the globe, for the world. And then we'll end up with how you could help us unlock female health equity as we step forward in our journey. And through the entire journey, what's important to me as an entrepreneur, as a business leader, is the ethics, the ethical entrepreneurship that is going behind every single building block that we are putting as a foundation as we build the company. So, what got me here? Well, a few acknowledgements are in order. Number one, you see Sam Gardner. Sam Gardner is the Director of Enterprise Works at University of York. And he was really the first champion that I met last year when I moved up from London to set up my business here. Sam made a number of connections for me, including Alice Ingram, who's with the Western North Yorkshire Chambers of Commerce. That led me to Professor Peter Ball at the School for Business and Society, and Professor Chris Williams, who is hosting us for the talk here. Sam also connected us to Professor Julie Wilson, and I'm very proud to say that within 6 months, we've completed 2 student projects with the Math and Data Science Department and also with the Business Consultancy Department here at the university. As a York-based business, we are absolutely committed to the prosperity of the region. And as I speak, we've submitted an expression of interest for the Santander scholarships at the university so we could get interns and have them working on the latest technology that we are building to address menopause. What got me here and why now? So until December 2021, I was an executive director at Ernst & Young EY in London. I was going through the partnership track, going through my panels, when I decided to close that chapter, a 22-year chapter that has seen me live in 7 countries across the globe. And I was running EY's people experience business that I helped set up during the pandemic. And by the time I left, we were in 100 plus countries across Europe, Middle East, India, and Africa with a 200-strong team. And there were a few factors that drove me to making this life-changing decision. Well, one of the many life-changing decisions that I've made. During the pandemic, while going through my partnership panels, I was asked to lead a EMEA board-level initiative for the pandemic called Project Incredible. In that project, we were working with, this was right when the pandemic struck us, and we were working with around 80 countries across the globe, helping them with their social distancing strategy, helping them with setting up their COVID command center. And we also ended up creating a social distancing wearable app with another startup in Norway. And all of this, as well as the shared pain, the shared suffering, and the compound interest in suffering that women paid as a result of the pandemic reignited in me the passion that I have always had as a 21-year-old to work for the public. And I said, it's now time for me to reinvest all the practical experience that I've got in the area of public health, because public health is a domain, these pandemics are not going anywhere, and it's a domain that requires bold leaders who have practical experience and who don't shy away from learning new skills that we need to solve this problem. So I had a very strong belief backed with my experience on the power of ethical entrepreneurship. The reason I joined EY over other Big Four was because of the principles that EY functions on with regard to building a better working world. Here are some of my education credentials. So hopefully you can see that I like to learn, I like to study. And in the duration, 6 months duration that led to incorporating the startup, when I resigned from EY, I also went back to school. So I went back to school to the University of Westminster to pursue a third master's in health psychology. And it was during that time where I said, all right, I'm looking for the most under-researched, underfunded area for impact. And I thought I'm going to do a PhD. The irony is that menopause is under-researched and underfunded for a number of reasons. And as a result of which, there weren't any academics who had built a career on menopause study. However, I kept going, I kept persisting, and I received 3 offers from UCL, King's College, and Monash, and almost took the flight to Australia to be in sunny Australia in Melbourne. When during my negotiations and interviews, what I saw is that my potential PhD supervisors, who were all leading academics in their field, were trimming my research question. And that was not acceptable to me. And I told them that, look, I'm a researcher, but I'm also a consultant. So I need to see the problem in its totality. I did not leave EY to just publish papers. With the grace of God, I've had those opportunities in the past. So I said, all right, the only way to do it is to do it my way and do a lifelong PhD. And that's how TaraCares was founded. We incorporated on May 30th, 2022. And what I wanted to share with you is the mathematical principle of inflection points. So in differential calculus and geometry, an inflection point is a stationary point, as you see, where the curvature changes sign. And if you apply that analogy to life, every single life-changing decision that I have made has been an outcome of just allowing myself to be in that stationary point, and at that inflection point, allowing for the energy of life to take me in the direction that it wants me to go in. And that's something that I wanted to leave with you, that there are lots of pivotal moments, and if we just don't restrict ourselves and have a vision that's limitless and look up in the sky, life has brilliant things in store for us. So this has been my journey so far. This is a snapshot of clients that the net new names that we put on the board for EY with the people experience business. I'm also a SAP Press bestselling author on SuccessFactors, which is a cloud technology for migrating your human capital management systems. And then life's taken me from India, where I completed most of my core degree education, to being in the States for, off and on for at least 13 years. And then I moved to London. And then from London, I came to York. And boy, do I love York. I have absolutely fallen in love with York. So May 22, TaraCares was founded. Here are just some of the moments. So this was my life until December 2021. These are some of the awards we received from the technical innovation that we created for the pandemic. It's been quite a ride, and it's been quite an adventure with ups and downs. Right. So with TaraCares, what is our vision? Firstly, the vision. When I started, I was alone, and I now have an entire team of people who've gotten behind the vision and the journey that we are looking for. Our vision is that no female should be left behind. She should receive the care and companionship that she requires and rightfully deserves during this essential and inevitable transition of her life, irrespective of her education, health, or socioeconomic status. And I mentioned those 3 factors because they are the individual differences that distinguish one woman's experience and access to care from another. Some gratitude again. These are some of our advisors. Professor Vikram Talaulikar, so he was going to be one of my PhD supervisors who signed up with me to be a collaborator and has been our main clinical advisor so far. Dr. Tianhua Chen, we have established research collaboration with the University of Huddersfield, and we've just finished a project on artificial intelligence where we analyzed the SWAN study, which is till date the largest study on healthy aging, and hence, applies to menopause. Marcus Heinen and Tom Pelema are senior partners at EY for EMEA, which is Europe, Middle East, India, and Africa, are helping us in raising investment. Sally Duffins, right here in New York, she leads a company called Nutrition in New York as one of our nutrition advisors on the platform. And Dr. Sally Jackson, who's the Chief People Officer and Pro VC at Sheffield Hallam University, is an amazing champion for us, who's helping us with getting pilot studies done of our tech that we're about to launch. If you're listening to this talk, and if you've been following the dialogue in the society on menopause, there is a mixture of debates going on. Personally, I think that social media and celebrities endorsing the problem has helped us, but very quickly it is progressing in the direction of everybody trying to jump onto the bandwagon and exploiting the opportunity instead of trying to address the root cause of what needs to be solved here, as we will be still sitting here in 10 years' time where women cannot afford equitable care for menopause. So we are changing the character and ethics of menopause with kindness, scientific evidence, and intelligence. And I would like to start with disrupting some myths for you. You may have in your repository of knowledge or things that come to mind when you think about menopause. And that's what makes it complex. Number one, you're never too young to be in menopause. So if you have a daughter, you have a wife, you have a partner who's in 20s and 30s, they are never too young. They could be diagnosed with premature menopause or early menopause at any point of time in their life. Transition to menopause, it's not a uniform experience because each individual is unique. And unfortunately, if a woman is diagnosed with premature or early menopause, which is if she plunges into it, between the age of 40 to 45 or during her 30s, that can be a thunderbolt. Or if you've gone through a reproductive surgery, let's say removal of your uterus or removal of your ovary, that puts you right into menopause. And the problem with our healthcare system is when a woman is making those decisions of, let's say, going through radiation therapy for cancer treatment, no one tells her that, hey, this radiation therapy is impacting your ovaries and it will impact your ability as a woman to conceive, or even if you don't want to become a mother, it will impact your entire foundation of the sex hormones that keep a woman standing and functioning as a complete human being. So for us, every expression of menopause counts because it's not just age-related. Even trans-masculine individuals who are going through hormone therapy for gender transition, they will go through some form of fluctuation of these hormones as well. Who's thinking about them? We are. And for me as an entrepreneur and as a founder and CEO, if it is not accessible and affordable, it is not a solution, period. I have a slide later on where I'll talk to you about the healthcare burden on the individual with the inflation and the cost of living crisis that all of us are experiencing for menopause. So what we are building is your personalized health companion from puberty to post-menopause. I want our technology and innovation platform to encourage women in their 20s and 30s to prepare better, to prepare when they have time, to understand that the reproductive decisions that they are making right now is impacting the later stages of their life. So this has been a bit of our journey. It's been quite busy. As I mentioned, we incorporated in May. In June, we were setting foundations when I met with Sam Gardner and we got accepted into the Phase 1 accelerator by Enterprise Works at University of York, which gives us office space at the Catalyst. That's been hugely significant in our journey because it gave us a big name of the university. It allowed us to attract talent, and it helped with the mental health of the founder, because now I had a space where I could go and work. In July, we wrote our first grant application for the Innovate UK, and bear in mind that until September, I was still doing my MSc thesis, so it was quite a busy period for me while transitioning into life in York from London. We submitted the grant application and we actually won it. So we got the Innovate UK award in September, which was around £49,897. It allowed us to scale our research. I was already doing pilots in York. And I think there's one story around it. I was my first interview was sitting in a cafe on Haxby Street, and I walked up to the owner, and it was evident that she would have been in menopause transition. And I asked her, "Hey, could I interview you? This is what I'm doing. This is what I'm building." And I was pleasantly surprised. She was, "Yeah, absolutely," because women do want to help other women. And then once we got the award, we started working on the projects. We did 3 projects. We did international study, which has representation from around 13 countries. We invested in Qualtrics as a research platform. We negotiated a research contract with the University of Huddersfield, and we also hired our first employee from Newcastle University to help me with the research work. While we were doing this, I was also working on creating the website. So we launched our website in December of 2022. And in January, we started working on the next grant, which was with the NIHR. Now, I want to bring up something here. Our second grant application was actually submitted for Women in Innovation grants. We scored 75%, which is quite a good score for those of you, I'm sure, who are used to writing these grants. We got really good feedback, but we didn't get selected. And one of the reasons we didn't get selected was the all-woman panel thought this was too ambitious. And I was encouraged to go and look for another startup that is led by a male founder and tag along with them. That was not acceptable to me. I said, all right. And they said that there are no demand signals from the NHS. I said, all right, now let's prove that's wrong, because the GPs actually do not know much about menopause. And we knew it because we had data. We had evidence from our research. So I went and wrote the NIHR I4I FAST, which is Invention for Innovation grant, and we won it in February. So we are now on the funding pathway for NIHR, and that is helping us in progressing our technical development. That was here. We were then invited for a keynote at Women in Health and Safety Conference in March. It's been unstoppable since then. We had designed the prototype in September, October timeframe. With the help of some of the funds from the I4I FAST Award, we started development, and we are currently testing Mimosa, which you will hear more about later half of this talk, where we are ready to do a private launch of Mimosa, which is a precision health platform. Last week, I was in Paris, where it was a huge stage on the inaugural MedFemTech Congress, where I presented our platform, where I presented what we are doing. And it was a fantastic conference for us, where we've made lots of good connections and with investors. And just last week, we were also selected in an accelerator called Well4Tech from Israel. So I'm going to be in Connecticut in June, pitching to investors for a week, morning to night. So that's been a little bit of a journey so far. We've created quite a few strategic collaborations. The AHSN, as some of you may know, is, it's a fantastic initiative which brings together the NHS, the industry, the collaborators, and the innovators. We started with the Yorkshire and Humber AHSN in England, and we're also working with the Wessex AHSN. We've created strategic alliances with NHS trusts and diagnostic laboratories who will complement the entire journey of the user on the platform. I'm again delighted to be here at the School for Business and Society, and I hope to work and continue our work more and deepen work with the academics here. And we're working with University of Huddersfield as well as Sheffield Hallam University. So here are just some of the pictures to show you what the journey has been. I really wanted to share my parents who traveled all the way from India for my graduation in February in cold York. And I think the pictures just keep it a bit interesting. And yeah, this was me. My second pitch. My first pitch was in London at the Samsung King's Cross building. And the second pitch was here, right here in the Guildhall, where it was fantastic to share our innovation and journey. We were also invited on the FemTech Roundtable, and these are all founders with established companies. And we were invited to share our views and our innovation on menopause, which was fantastic. For the academics in the room, menopause assessment tools have been developed 70 years ago. They are still in use. So the green climacteric scale and the menopause rating scale are two main tools that our GPs and doctors all over the world use to assess a woman's stage in menopause. That is unacceptable. Even the symptoms over there are a finite list, and there is no finite when you talk about menopause symptoms. So that's another area that we are working on innovating in terms of the menopause assessment scales. There's a lot of good work happening in Australia and Canadian universities. And if there are any academics who want to join forces with us, please send me a message. I'm very proud of these moments. This was Professor Julie Wilson from University of York, kicking off the Maths and Data Science project. These are students from Professor Peter Ball's School Business Consultancy project. That's phase one and the Catalyst building that some of you may be aware of. And then TaraCares as a business, we hosted a lunch for Peter and the students as a thank you reward for them. And while I've been doing all this, I've also been skilling myself up. So I've been at the International Menopause Society Congress in Lisbon twice and going through a number of trainings to make sure that we're not missing the ball on any aspect of this arena. That's me and my designer. He's a 27-year-old young man in Nigeria. And I can tell you the nuances that I wanted to see in our design, for the design to be inclusive, for the design to be accessible. I honestly think I wouldn't have gotten that if he was not somebody in Africa, because these men are seeing their mothers, their aunts, they're seeing their relatives being left behind. And the men just saying, breaking up relationships when the woman is in the menopause transition. So it was quite hard. It's been quite a heartwarming experience for me as a founder to design our platform. Now let's talk about the scale and complexity of the problem. And why do we need another menopause startup? Because this was a very important question that I had to answer for myself. Because when you go the startup route, you're all in. And I'm a full-time founder. I'm not doing a part-time job and doing this part-time. And that led me to a lot of research. That led me to, using my 22 years of corporate experience and market research experience to understand really what the competition was doing or what the investors were investing in. A quick reminder, this is our team. So here's the effect by numbers. We do not have the numbers for the UK healthcare burden, unfortunately, but in the US, because of misinformation, misdiagnosis, and mismanagement of menopause, the burden is around $12.9 billion for hypertension. Now, one thing to note is during menopause, it's not just a fluctuation of hormones. It's because of those fluctuating hormones, it's a secondary health conditions that women are put at risk for. And because nobody is discussing that during consultations, women are not aware of that. They may go for years and, for example, until they get a fracture, they don't know that they actually suffer from osteoporosis. So that's the beast that we are dealing with here. $2.7 billion for osteoporosis, $8.7 billion for depression. And that doesn't even begin to tell the story. Women suffer from depression due to menopause-related symptoms. Families are being broken. And it's not just families being broken. Imagine a woman who's in her 40s, probably has an adolescent son or daughter, and they are going through their own, adolescent issues, and she's going through her menopause transition issues, and maybe the father is also going through an andropause. So, it's havoc. It creates havoc for families if they are not aware of it. Within the UK, and this is just for 2021, the public health expenditure on hormone replacement therapy or menopause hormone therapy, and this is only for 2 of the formulations, was £65 million. That's how much the country is spending on menopause hormone therapy. And we are still having the debate on the shortage of hormone therapy. So what we want to do is we want to offer we want our AI models to offer more targeted prescriptions for hormone therapy. The impact on women in society in UK, now that number has actually now gone to 15 million based on one of the papers I read last week. There are around 13 million women in menopause transition. In the US, around 1.5 million women are entering menopause transition every single year. And our urban lifestyle, the pollution, all these factors are not really helping, because what they are doing is they are bringing forward the age when women start experiencing these symptoms. Also, there are ethnic differences. So for an Indian woman, the average age is 45 because of her nutritional aspects, because of her ethnic makeup, while in the UK, it is the average age for menopause is 51. So an Indian woman or even a woman of South Asian origin loses a good 6 years, a good 6 reproductive years in her lifespan. So why do we need it now? Now, here's what's happening in the industry. You've got telemedicine platforms, you've got symptom tracker apps, or you've got at-home hormone testing kits. These are the 3 main products that are out there in the market. And all these products are aimed at exploiting the problem. And why do I say exploiting the problem? Because number one, they're medical peddlers. Now, we know that the medical expertise is lacking. So what is the quality of expertise that you're offering to women? Hormone testing kits, if you are a good researcher and have read some high quality papers, you know that the dynamic nature of estrogen, progesterone, and testosterone doesn't really tell you much. They have a role in that patient's journey, but in and of itself, a hormone testing kit tells you nothing. You're just wasting your money. Here are some of the startups which have been founded in the past 4 to 6 years, and they are all backed by venture capitalists. And why we differentiate from them and future startups is because we are addressing the root cause. Number one, I talked about hormone testing kit. Number two, clinicians lacking medical expertise. But we want to work with the clinicians. We want to augment their medical expertise with our platform. So what we are building is a unique, and you don't have data. So you can imagine that we have taken on a seemingly insurmountable challenge when I say that we are building predictive models, because we first have to start right from rock bottom in getting that data. NHS does not have menopause-linked data. Yeah, there might be some bodies who may have, disparate data on certain factors, but there hasn't been intentionality behind female health. And there has been even less intentionality when you talk about post-reproductive phases of a woman. That's the reason why doctors were not even trained on the post-reproductive phases. So all of that, I sat down and I said, you know what, something's missing. We need to look at the problem in a different lens. And so we were doing our research. While all of this was going on, we were doing our international research. We were analyzing sworn data, and and it was a mixed methods research. So here are some of the qualitative comments. I'll just read out one of them. When this lady says, "I had hysterectomy, which is removal of your uterus, before age 44, and nobody told me I will plunge into early menopause. Then in my 40s, I had terrible brain fog. My employer put me on an improvement plan, and that was the end of my legal career." And I get goosebumps every time I read these comments. That's just one woman, and that's happening to millions of women in different shapes and forms. Here are some other ones. This lady says, "I've experienced very bad primary healthcare treatment when suggesting early menopause as a possible diagnosis, and her health has suddenly changed." Now, here's the deal. It's not happening suddenly. It feels it's happening suddenly because you've not been monitoring your health. You see? So our goal is to offer women a platform and scientific evidence that encourages them and gives them a reason why they should be monitoring their health, and we help them in doing that. So she said, I felt somewhat excluded from initiatives because people simply don't believe I should be there. And that's still just the tip of the iceberg. So what are the challenges? The challenges are three: misinformation, misdiagnosis, mismanagement. Research-based scientific information is lacking. There is still very limited research. So research is one of the core verticals of our business. We will continue to work with the NIHR. We are looking for universities who want to be intentional about menopause research. So if there are any academics who are listening to this talk and you're interested in pioneering the way forward, helping an early stage startup with your experience, shoot me a message. Number two, the misdiagnosis. There's lack of real world evidence. We in the UK are doing slightly better than the US because we still have more evidence and we have papers and guidelines from National Institute of Health and Care Excellence, but we are also reviewing all these guidelines from NICE, from British Menopause Society, from North American Society, and there's incongruence between these guidelines, because guess how these guidelines have been made? They've been made by consultations where you get a bunch of clinicians in the room and you are again limited to the patient histories and cases that these clinicians have. So what I want to do is use the power of computational science, and once we have a critical mass of data, create scenarios that doctors haven't even seen yet, because you can do that with explainable artificial intelligence. In mismanagement, while hormone therapy is the gold standard, it is not a magic pill. And I think some of the women in the society are now waking up to that fact. Also, hormone therapy always comes with side effects. So if you're a woman who's taking hormone therapy, you are having to make a trade-off between, am I okay with bleeding, or am I okay with nausea, or am I okay with headache or indigestion? So it's not like the symptoms go away. It's really just to manage your symptoms. So what we want to do is we want to see you as a whole individual, and we look at your nutrition, your self-care, your psychological symptoms, and all of those data points build for you what we are calling a Mimosa Health Profile in the platform. So here's the problem statement. When I speak to investors, they say, Jyoti, what is the one problem that you're solving? And I tell them it's not one problem. So let's change your mindset right away. It's not one problem. It's a multi-dimensional problem. Number one, there's no regulation. And the way things are going, I don't think there will be regulation for another decade or so. But who suffers? The woman. Because there is no regulation, your pharmacies are tasked to do their due diligence, or your GP or your specialist is tasked to do due diligence, and they're not. And who's suffering? The woman. It's not age-related. So it's not age-related symptoms. There are background risks of the individuals that vary their experience. We don't have doctors. We just don't have enough doctors. So, when you read the NICE guidelines, for all the complex cases, it says, refer to a specialist who is not there. And number four, science. Science and research-backed awareness is not there, and we just need more research. There is no other way. So we are tackling the stigma, the suffering, and the silence of menopause with tailored awareness, timely diagnosis, and total management. How are we doing that? This is a very sneak peek because we haven't launched yet. So the TaraCares trifecta is built into two platforms. As I mentioned, Mimosa is ready for launch. So we are looking for early adopters. I'm already pitching to employers, universities, healthcare providers. So if you have connections, if you have a network, if you can introduce me to any folks that could help us, please do shoot me a note. I have built software as a service tech platforms my entire life. And that's how we've built Mimosa. So you pay what you use for. It is not an app. It is a platform because it is aggregating the various services that a woman will require in order to navigate menopause transition with science. The first release has three main features. One is Menopause Science, which is we are bringing research that's there outside the ivory towers and transforming it into consumable articles, videos, blogs for women. But you're not overwhelmed when you're on the platform, because as your Mimosa Health profile builds, this content is tailored to you and is recommended to you. It would be a subscription-based menopause training that this will develop into. So, for example, I was in a webinar with the Department of International Trade, where there are opportunities in the United Arab Emirates for menopause health literacy, and so we're going to explore that option in terms of commerciality of the platform. The next one is symptoms. We are calling this module as Health Trace now, where you log your physiological symptoms, your psychological symptoms, your nutrition, and your self-care. We also have life events. So, for example, a woman going through fertility treatment. She doesn't realize that the fertility treatment, she's taking hormone injections. So that's going to bring forward her menopause symptoms. So we need to connect the dots there, and it's our first attempt to connect the dots. And when we have the data, we build the algorithms behind it to speed it up. And then we have appointments. A lot of women, here's the reality, women wait for 7 to 8 months for an appointment or more. They've got 10 minutes with the GP or the specialist, and they feel like they've dropped the ball because they can't remember half of the things they wanted to ask. So what we have in appointments is all your Mimosa Health logs will be packaged for you. You can export them as a PDF. We can send them to your doctor if you would like us to do so. It also gives you tailored questions that you need to ask, and it also gives you a place to jot down your appointment notes. So you are just giving us that information, and we are doing the heavy lifting for you to continue to inform you on what your next steps should be. And Monoculus we still need to build the proof of concept, but Monoculus will be a decision support tool for clinicians, and Monoculus and Mimosa will be integrated in the back end. In future, with Mimosa, we are going to integrate through, let's say, with the Apple Health Watch or any other wearables that you are using, so that it's not self-reported data, it's actually real-time data that we get into the platform. So this is how it works together. As I mentioned, misinformation, misdiagnosis, and mismanagement is underpinned by 3 innovation pathways in our platform: awareness AI, diagnostic AI, and management AI. That's Mimosa, and this will be Monoculus. And through these innovation pathways, we are hoping to achieve patient engagement and involvement, closing the gender health gap, and really, really demonstrating what it means, and not just talking about female health equity. These are some of the screens from our actual platform that I can't reveal completely, but I still wanted to show you just so you get a flavor of the design. If we are able to get a good adoption, then I think within the next year, we should be able to create what we are calling the Mimosa Health Graph, and be able to get on specialists that we need to do that. So what's the business model? Number 1, does not involve selling your data. So whichever companies you can think of, which are period tracker apps, they haven't made money by giving away free apps just like that. They have sold your data. And that's not our business. We are in the business of solving the problem. Our business model is direct to consumer for launch, but our main business model is direct to business. And how are we going to do that? We are at seed stage. So during seed stage in the UK, we are trying to get into NHS trusts, employers, health plan providers, and private healthcare in the UK. I'm already having conversations for a US launch, but of course, as you can imagine, we are a health tech, and once we launch in June, we will be doing activities with the Medical and Health Regulatory Authority to make sure that we are a class 1, at least a class 1 medical device. And as we progress, we will become a class 2 medical device. So there's a lot of work that needs to be done in the next 3 to 4 months before we can actually launch internationally. But we need to gather evidence. And my next grant with NIHR is exactly for that, to run clinical trials. Worth mentioning, we're also working with the York Health Economics Consortium to help us with our early economic models. That's Mimosa, which we aim to put in private hospitals, healthcare, as well as if you're using Monoculus, then the data is shared between the 2 platforms. We're also working on operationalizing TaraCares precision health clinics, which would be virtual clinics. So if we have a user who's on Mimosa, we already have their data, which allows me to make it more affordable for them, which allows me to really slash the skyrocketing private health consultations. How is TaraCares different? I'll just talk to you about one challenge on ethical entrepreneurship: the data on ethnicity. When we did our research, if you look at any of the apps, there'll be a standard list of ethnicity. When we started working and designing that data field on the platform, we saw that, number one, ethnicity, there isn't a stable definition of ethnicity from the ONS or from the government statistical standards, because it is so individual, and it also changes. For example, I am now a British citizen, but if you ask me my ethnicity, I will still say Indian. Maybe in 10 years' time, I will say I'm English, but not right now, right? So the list of ethnicity for England and Wales is different than for Northern Ireland, is different for Scotland. So just within the UK. So how did we tackle that? We have combined the existing lists. Through our research, we have more ethnicities based on our research participants, which is now on that list. And the individual is able to add their own ethnicity. So that way it becomes a dynamic table that's updated in real time. And in the back end, we have a hierarchy that's building out. So when you talk about the precision of research and the data that will come out in terms of insights that we can use. So for example, we could look at deprived areas of York and say, hey, this is the ethnic dominance of this particular area, and we need to mobilize menopause health literacy campaigns because of what we are seeing in that area. That's something we're also working on. I aim to work with the academics at University of York if they can help us with dynamic pricing models. So what I want to do is, even starting with the York Council, I want to see if we could authenticate somebody's purchasing potential, then we could automatically adjust the pricing. We are also submitting an expression of interest for the leveling up agenda and trying to get a share of the budget that York has been allocated, because I want to run menopause health literacy campaigns in deprived areas of York. And we're looking for interns from the University of York to help me do that. So I mentioned the healthcare burden of menopause. I call it the black box. So this is a good representation of what women are paying and what their journey is. If you are lucky, you get a private clinic appointment, and this is what, 100 to 275 pounds or more. If you have a specialist case like cancer or early menopause or have had reproductive surgeries, it'll be more. You're then sent for blood tests, DEXA scan. DEXA is for your bone scan, so many tests, and this is the price only for one test. Then you are advised to go for a monthly or a quarterly review, and that's the price again. Then you have separate prescription costs, and you have additional hormone therapy costs. And oh, by the way, if you forgot to ask any questions and you have out-of-turn questions, you are charged anywhere between 30 to 60 pounds for ad hoc prescriptions or ad hoc questions. And that is still just the start. And here's what no one's thinking about: the cost of lack of medical expertise and resources, the cost of generational inequality that's there, travel costs. I had a user who travels from York to Cornwall to meet her specialist every 6 months. Side effects, appointment waiting costs, delayed diagnosis, secondary health risks, broken homes and relationships, losing employment, losing yourself. For me, that's the biggest cost: losing yourself, or not being able to say, here's who I was 10 years ago, and no one's there to tell me how to find that self-orientation, because so much in you is changing, and dismissal by the healthcare system. So one of the challenges that I have posed to our team at York Health Economics Consortium is, when we are looking at the various modalities of economic modeling, I want a way. If there's not a way, we'll create a way. I want a way to quantify these costs, because until you quantify those costs, we still don't know the real burden that women are shouldering and families are shouldering. So, call to action: how can you help us unlock female health equity for the long-term female health? Number one, Help us with your research. There is so much wealth of expertise in the university. I'm open to having a conversation with anybody who feels committed and passionate and wants to demonstrate and translate their research into critical and tangible patient outcomes. This is my lifelong PhD. Join me. Research assistant grant applications. NIHR has actually allocated a lot of funding to menopause health research. The problem is there aren't many who are doing that. So if you want to get together with TaraCares for an industrial research collaboration, I'm absolutely open to having a chat with you. Collaborate and scale our research. So I mentioned dynamic pricing models. We already have a team on the ground in Uganda. So I'm working with the Menopause Health Charity in Uganda, and they've sent me a bill in terms of what it would take to go to the healthcare. They will do all the work, but we need the funds. So if, with the Office of Philanthropic Partnerships and Alumni, if there's anybody who's listening to this and you can connect us to donors who are intentional to use their wealth for equality and for equity for women, then I'm very happy to have a conversation. Help us with early adoption. University of York has a huge convening power in the industry. Help us get in front of those audiences, being a York-based business. And then if you are a woman in menopause transition, and again, if you are 40 or above, you are. Whether you want to acknowledge it or not, you are in menopause transition. And if you are a woman of South Asian origin, your symptoms have already started in your 30s. So if you are in that category, if you're in your 20s and have been diagnosed with early menopause or premature menopause, help us offer early feedback to our platform. It's a cross-platform, so both Apple and Android devices. And then help us with early adoption through your corporate and NHS networks. So that's what I had for you. If anybody wants to reach me, that's my email address. You will receive a response within 24 to 48 hours. That's our website. Check us out. And we're at the Catalyst in York Science Park. Thank you for listening. And thank you for any follow-up actions that this talk motivates and inspires you to take forward. Thank you.